So that tells you what it's on, so it's on video. It's videoing now.
Recording it now.
We have an NHS crisis. People need to listen, they need to believe it's real, because it is.
We're at the very beginning, really. This is going to carry on for a long time. It's going to be months and months and months.
The region was following a similar pattern to what's been seen in Italy. Almost half of Wales's confirmed 628 cases have been identified in the area.
What we have seen in the Gwent is a lot of young people.
Oh, your wife's on the phone.
I love you so much. I miss you so much.
It's like half an hour or so before I start going, and I can feel my heart racing a little bit more.
It's just taken me about 10 minutes to find my shoes.
It's recording.
This is the before the second cup of coffee phase.
I've got coronavirus, and it's just frustrating not being on the front line.
My face is starting to hurt quite a lot now.
Let's go. You love. Let's go.
We are just getting ready. Hello? For the BBC documentary that we are filming.
Hi, here I am. I'm back at work. Got my PPE on. Great to be back with all these lovely people around me.
Great to have you back, Dave. Welcome back.
There we go.
I'm ready.
We work at the Royal Gwent. Our catchment area goes really from the borders of Powys up in the north, up near Crickhowell, all the way down to Newport itself. And then there's a huge variation in the demographic down there. But traditionally, this has been an area of high social deprivation and particular health problems. And we see that in our day-to-day practice. Newport is known for seeing more extreme pathology than you'd see in some of the metropolitan centres like Cardiff. So we've always had not a desperately healthy population, but at the minute we're in the epicentre of this outbreak, really, outside of the big metropolitan areas, London and Birmingham. Per head of population, we're seeing more people at Newport who are desperately unwell than most areas, and certainly much more than the rest of Wales.
I'm going to have to pop his peak back up to 14. Yeah, go from the peak to 14, and then just hold it at there for half an hour and see how you get on.
The NHS in Gwent could be following Italy and faces being overwhelmed by a rapid increase in coronavirus cases. That's the warning tonight from a senior official. An Bevan University Health Board has seen 309 confirmed cases of COVID-19. That's almost half the total for Wales and more than twice the number in any other area.
The pattern we are seeing in Gwent is the same pattern as we're seeing in Italy, where their healthcare system is now overwhelmed. Without a huge effort by all of us, we're heading for the moment in Gwent where our NHS will be overwhelmed too.
It appears that Gwent has been the hardest hit from the start. So we had the highest number of confirmed infections in the community, and we have seen the first patient on the intensive care unit. And it's a dubious first that we were the first ICU to go into surge capacity.
We hit what we call surge capacity yesterday, so that's when we go beyond what we normally nurse in normal nursing ratios and normal doctor ratios. Surge capacity is something that we normally talk about for, say a major incident, so a bus crash for a short temporary period of time. You have massive amounts of people, but that is short-lived. This feels like it is something that could be protracted for 2-3 months.
On the main OTU at the minute, there are 16 patients. Everyone's jammed in. everybody's ventilated, everybody's unconscious, and there are just rows. As you walk into the ITU, you just see 2 rows of people who are all unconscious, all on ventilators. And then as you walk through the different areas, there are just more and more and more people. So it's really on an industrial scale, it's whole scale intensive care. And that's something we've never really been exposed to before.
This is ITU recovery. We've got 4 patients in here, and then we've got another 3 coming up the side.
We're at the start of the pandemic, so it's very, very full. Everybody's in full PPE, so it looks like something out of a film. I don't recognise it as my workplace when I go in. It's not something I'm used to.
Just being in the corona unit, we are overflowing and fitting patients in between gaps as much as we can.
It's stifling sometimes. So I've just come out to have a quick cup of tea and possibly some chocolate, which will keep me going for the afternoon.
So Tanya is in her break. Bit of mask fit testing ongoing, which means they can go into our red zones.
You okay? And a hairnet, please. Very stylish.
Right then, break over, rehydrated. I'm going back in.
Go up to 50% on the oxygen. And while we are here, if we can just lie him flat.
It seems to cause very nasty inflammation in the lungs, and for some people, needing significant ventilatory support, and ventilatory support in a way that is different to other pathologies that we normally treat.
In the first phase, what we see is very small clots forming in the body, and those little clots are blocking the vessels in the lung, and that's what is causing the air hunger, for a better word.
Try 14, try changing the IE ratio, and then have a look again in half an hour. All right? Okay, bye.
Thankfully, we've got a lot of experience of people with severe respiratory failure. Certainly, some of my colleagues, that's really their area of expertise. So, we're in a good position to look after these patients, but the volume of them is astonishing, really. It's like nothing we've ever seen before.
So how long has this gentleman been here?
He's been here since day 11.
His tummy looks very swollen.
Yeah.
We were led to believe that it was, older, frailer patients with comorbidities who'd be affected by this, but actually it's turned out to be a lot younger. The first patient we had was in his 30s. We've had a couple in their 20s. There are a couple who are older, a couple in their 70s, but it seems to be mainly people, particularly men in their 40s and 50s, that we're seeing the most of at the minute.
Okay? Don't worry about it.
The other thing which we have seen, which is in line with some previous reports, is that those patients who do get to the intensive care unit, then they will need to stay there for a long time.
The data coming out of Italy says that if you're going to survive, it's at least 2 weeks in ICU.
Yeah, that's what our figures look like, doesn't it?
Yeah.
Yeah.
2 to 3 weeks, probably.
I would say 3 weeks minimum.
Yeah.
I think it will end up being a bit of a bottleneck situation where the problem is you can't get them better quickly enough. So you could deal with this if everybody needed 2 or 3 days of critical care, but they're all needing 3 weeks or a month, and there's no space. That's the problem. And we have to have a place to stack patients.
What we've got down here is where coronary care used to be. They have very kindly relocated for us. And what we are doing today with the team is staffing this and putting kit in here, and there's a team of people doing that right now.
The main intensive care is overspilling, literally, with patients. And then we've had to spill over into the coronary care unit as our next site to spill over into. And we're looking at different pockets in theatres, in recovery, and so on and so forth, for us to put the inevitable high number of patients that we will have.
And when will this become functional, do we think?
We are hoping that in the next 24 hours we can have this up and running as our next requirement. There's a few things that have been causing a lot of anxiety all along, like the pumps. That's one issue for us, and we need to look at that next. We've got pharmacy coming to stock places, hopefully, and then the nursing staff are going to support and do a final walk around. So that's some of our senior nurses tomorrow to look for teething problems.
Next door, we've got another 6. And then we could also, on top of that, then we could fit probably 4, realistically 4 in here. If we include this area, it'll be 20 more, which will bring us up to 42. And we've got 90 ventilators, so we need to find space for another 46 patients somewhere.
And I think the biggest challenge will be not the ventilators, it will be the staff.
How's your night going, Charles?
Busy. Just resetting up a filter for the last 4 hours, so a little extra bit of work that I did beforehand.
Our patients are going through quite a lot of filters at the moment, so we regularly answer that. MK? Enjoying the night shift?
Always.
Laura? How are you finding the night?
Just giving my patients some paracetamol. She's got a temperature.
They all have.
So it's 3 o'clock in the morning. I've been on since 8 o'clock this morning, doing a 24-hour shift. Just found a quiet corner to try and have a little bit of kip. Hopefully the night will be okay. We're pretty full. We're up to 26 patients now, I think. No, scratch that, 22. And we've got space now for another 20 ready. At the minute, we're filling up at about 2 patients a day, sometimes more. So I would think by the middle of next week, we'll be looking at about between 40 and 50 patients here, which is, 4 times our usual capacity. So, no lag.
So that tells you what it's on, so it's on video. It's videoing now.
Recording it now, yeah. So you can't see where you're recording? No, I think the memory's going to be filled up with us going, is it recording? Yeah.
Joe, hello. Joe has tried to leave us and come back from the community to support ITU nursing in this time. Yeah. And Joe is here looking after a couple of patients. So as before, we've normally had one-to-one nursing. We are now 1-to-2.
There is a lot of focus on kit at the moment in intensive care, and now we are starting to realize that the focus will need to be on staff. So normally, if a patient is on a ventilator, there is one nurse to look after one patient. At this moment in the Gwent, most of the patients are looked after in a 1-to-2 ratios with the help of other staff.
Florin is from day surgery and has never done intensive care in his life. So it takes a lot of courage to come out and come into ICU and offer help. So I've just been sort of teaching him all about the basics of what we do here on ITU.
You're going to be fully taking over from Lisa now, okay? Don't look like that, and see the fear in your eyes. Behind your glasses and your visor. Janet is here. She's an ITU nurse. She'll come support you. I am never far away, okay?
The nursing staff have got a really difficult job on their hands because they are really being expected to work outside of their comfort zone.
This is my first day here. So.
No, that's fine. Yeah.
So they're very uncomfortable with that, understandably. They're still doing a superb job, and I can't underestimate what that must be like for them, but also the respect that they are earning themselves at this time for continuing to do what they do so well in such difficult circumstances.
This is my 3rd shift in ITU now.
So just 3rd shift in ITU?
Yeah.
Wow, how's that going for you?
I'm getting there. It's still quite scary. The support from the ITU nurses has been absolutely phenomenal. So at no point have I ever felt that I'm I'm completely out of my depth.
It's so hard because the ITU nurse is there trying to look after the two patients. Theatre nurse, scrub nurses are coming in, and sometimes they are having to take a patient with the
ventilator and the drugs.
Yeah.
That's got to be pretty challenging for them if that's not their normal role.
It is.
He put his oxygen up and we have to put it back down.
well done, mate. Okay.
We have tears at the beginning of shifts, we have tears at the end of shifts from our own staff as well, where we're all pushed to the limit. We've had tears ourselves at times.
It's 2:20 in the morning and I'm really tired now. We have had loads of cakes given to us. One of our secretaries and her friend brought us a whole load earlier on today. So as you do, I've just had 2 cakes and a Cadbury's cream egg at 2 o'clock in the morning, which is obviously what you do when you're trying to stay healthy in a pandemic.
It's 5:15 and my alarm's just gone off. I'm just gonna go get ready for work.
Things I'm thinking about as I'm driving to work, how many patients we've got, are we still getting admissions? I suppose still thinking about whether the numbers are going to go up or are they going down?
Hello, up nice and early, ready to go into work to do a few hours. First task of the day though is to get these two into childcare.
And we are on our way to our little playgroup drop-off. Where are you going, boys?
Into the sky.
So Mummy can go to work?
Yeah, and come back again.
Yeah.
It's a really worrying time for me when I do drop them off. I feel that am I putting them at risk by taking them there? And we have to remember these people looking after our children are also putting themselves at risk, so we should be really, really thankful for them.
As you can see, I'm making the most of the nice weather and the break in between shifts to get my daily exercise in. It's really important because when you're on the unit on shift, you don't even know what the weather is like on that day because you don't leave the building. I just come up here on my own usually. I'm on the canal and I just listen to my music and process everything that's going on.
I've had a few days off, so to be honest, I do feel really anxious about going in because I know just in them couple of days how much things can change.
It's just really tough. I think a lot of us are really anxious about going to work. Myself, dread going into work at the moment, which is not like me at all. I think everybody's in the same boat, really. We've got a lot of staff off sick as well.
Like, it's like half an hour or so before I start going in, like I can feel my heart racing a little bit more. Yeah.
Even the hospital doesn't even quite look the same. The staff are now allowed to park in the visitors' car park. Good morning, Mark. How are you? You on today?
Thank you, yeah.
We'll go and get changed and see if there's any shoes that's going to fit. See what we can get. Oh, we've got different colours now.
Yes, we're selection.
Oh, I'm liking the turquoise. Hi. It's Leanne, Naomi and Emma. We're just about to start our shift. It's Monday. Is it Monday?
It is
I
Monday.
think it's Monday because I don't know anymore. A lot of us couldn't wear makeup because the masks just give us spots, but we've also got our bras on. So that's always a positive.
Let's
Sending you love. Let's go.
All the staff are wearing PPE, so it's very hard to know who's who. You know, I was chatting away to someone the other day and I didn't actually realise that it was a nurse that I know very well because you can only see people's eyes. It's sometimes hard to make out who's who.
I'm going to go in. I've got pink stickers to tell everyone that I'm an airway doctor. My name written on there because no one can tell who anyone is, so they've got all this PPE on.
It is very, very tiring for everybody to be in the full PPE. You can't drink, you can't really sit down, and you can't hear each other properly. because of the mask, you lose the non-verbal communication. So it is difficult.
It's hot in the bloody camera, don't it?
And we haven't lost our humor. So, you know, we are still the same bunch of people who are joking, who are laughing.
I just want to reach in to get my gloves.
We don't realise how much we rely on human interaction.
We don't have Lance Opera, so. No, I'm asking.
How much we rely on just facial expressions, seeing people's mouths when they're talking to you. All that is gone.
They just introduced the azithromycin.
Erythromycin.
Azithromycin.
Not only is it a stranger you're having to become acquainted with, it's a stranger whose face you can't see, so they remain a stranger. Even in that working environment, you'd never see, if you walk past them in Tesco's, you'd never recognise them, because even though you may have spent 12 hours on a shift together, you've never seen their face.
What are you doing, boys and girls?
Taking all this off in a nice clean way so I don't get covered in germs.
Can you both get completely naked here now? Is that how it works?
Pretty much, yeah.
Yeah, I thought so.
Down to my G-string.
Because why I come to work every day, people?
Every day.
So we started shift at 7:15ish, and it's just gone 10 o'clock now. So the masks we've had on have been on for about 2.5, 3 hours. But in that time, you can see like the indentation in the marks. My chin's quite red. Like straps over to the ears as well. The ears get quite red. And like the tip of my nose and the bridge of my nose. It's quite stuffy in there. It's just dehydrating and frustrating and all the other ings.
My face is starting to hurt quite a lot now. It's quite sore, but thankfully glad to finish, and I'm handed over to the night shift. I'm just about to go in the shower and get nice and clean because I feel sticky and horrible.
How's the PPE wearing going?
Not good.
Not good. Hot?
Yeah.
It's really warm. And it's sore on the ears.
Hot nurses?
I wouldn't say that.
We were definitely ahead of the curve in terms of sorting out our PPE arrangements. There's been a lot of conflicting advice. So the World Health Organization's advice was very much belt and braces. You need the full shebang, respirator masks, coveralls, 2 pairs of gloves, etc., etc. Whereas a lot of the advice on PPE that came from Public Health England was a bit more wishy-washy. It was, you just need a surgical mask and an apron. And, we know that it's certainly in intensive care when you've got a huge concentration of patients who are all secreting virus that, we knew that wasn't going to cut it. So very early on, we made a policy where we would go for red PPE the whole way through, which is the sort of the highest level of personal protection. So we're doing what we can to keep our staff safe. But yeah, that's a huge risk. And we've seen people die. There's a chap I know from Cardiff, unfortunately, who's a cardiothoracic surgeon, died a few days ago. We've seen a number of healthcare workers in intensive care. So the threat of transmission and the threat of contracting coronavirus is very high and it's very real. Bobby, what have you got there?
Well, I got a will for me. These tough times, you just don't know who's gonna be dying, really, to be honest. So Priya and me made a decision. At least we'll write a will. We've never done it before.
Yeah.
So the kids are taken care of, just in case. We both of us work in the front line, don't we?
Yeah. So you want me to witness your will?
Yeah. Could you please, Dave?
Of course.
Thank you.
So you can just see behind me that we're doing the 8 o'clock Thursday clap. I've got to say, it makes me feel more than emotional that all these people are actually outside clapping for the NHS. Well done, us.
It was just really emotional. We all had tears in our eyes. Really proud to be part of the team that I'm with. My daughter now, she's a second-year student. She's being called in now, waiting for her contract. Yeah. And she's going to be going down to A&E and MAU on the front line. Really proud of you, babe.
I'm proud of you.
Look what's
somebody dropped on Marnie's doorstep.
Oh, that's cute, isn't it?
There's a whole bag of them.
That's sweet. Where's the little heart so I can show Dave?
Oh, look at this heart that was on there. You need to take a picture of the heart.
Like that. Take a date so that you need to know what somebody dropped on Marnie's doorstep. A whole bag of them.
Oh, that's lovely.
I got stopped by my neighbour who gave me a little gift bag, and inside the gift bag was the most thoughtful gift ever. She's given me one of these little teddies, and it just really hit me, and I got quite emotional about receiving this because it was so thoughtful and just really overwhelming.
People have been delivering food and drinks and everything to us. They've been really kind. We've got bottled water, Barocca, lip balm, and toiletries and stuff.
This is our rainbow wall, and this comes from our children, our grandchildren, neighbours, anybody else. So when we're actually in having a drink, we can have a chat and we can sit and look at the photos, and they all make us smile a bit.
So we're just sitting down to lunch. We've just received a big box of meals, so we're very grateful. And you've got piri-piri. I've just had lasagna, it was delicious. And I happen to know we're getting cakes at 2 o'clock, guys.
We drink 3 of these every time we come out of the unit because we're so dehydrated. So just wanted to let you all know that we're all doing fine and we're keeping each other's spirits up. Okay?
To help tackle coronavirus, all Welsh hospitals have restricted visiting for patients, and the advice remains for all of us to try and stay at home to help slow the spread of the disease.
Currently, there is an all Wales visiting policy for the hospitals that there is no visiting. And that is to try to reduce the spread of the infection. That makes everybody's life extremely difficult. First, they can't see their loved one, and they can't interact. And that takes away the very important point of that they see how unwell the patients are, or what are the changes, or how changes are not happening on a day-to-day basis.
Hello, ICU.
Talking to families is 50% of what we do. You know, our patients are unconscious. You don't know them. They're just an unconscious person with a tube with loads of pipes sticking out of them. And obviously you try to be as humane and compassionate with those people as you can. But what really massively helps is getting to know them, and you get to know them through their families, and you understand what their hopes, their dreams, what their fears are, what kind of people they are. And you form very strong bonds with their families, and you help them through what is an incredibly difficult time.
His chest is his big problem, and he's on the ventilator at the back.
And at the minute, we're doing it all by phone with people we've never met.
He's now sort of steady from a chest point of view, and that is good.
I'm finding that the most difficult thing of all, because, you know, disembodied voice, wearing a mask so you can't hear what they're saying, on the telephone, you know, it's the least personal way to give any advice. I had a terrible shift on Thursday night where a young person died. And it all happened very quickly. You know, this patient got to us at 11 and was dead by 4. And I had to do all the sort of A, breaking the news that their child was desperately unwell, and B, that they were going to die imminently, all on the telephone with someone I've never met. And I found that really, really, really hard. And most of this, we signed up for looking after people who are dying. It's what we do. As well as getting people better, we have 2 deaths a day sometimes. 20% of patients die before they leave intensive care. So, I'm no stranger to death. And I think it's important to give people a good death as well as every chance of recovery. And if they can't recover, you give them the most peaceful death with their family around them that you can. But in that situation, I couldn't. And it was, you know, as a parent and actually just as someone who cares, it was really hard.
It's very, very challenging for us. It's not normal circumstances. It's really, really difficult. However, there is a light and a bit of positivity in there. We've had a lot of iPads donated to us, and this helps them. So our patient who is extubated, hopefully in the morning we can ring his wife and they can have a little video chat.
Robert! Rob! Robert! Robert, your wife's on the phone! Rob? Rob, Carol's there.
He looks peaceful.
He is. Can you hear?
Oh, I love you. I love you.
So I'll explain to you now the things that he's got, so you know what all of the bits of support are and the bits of kit. So that tube there goes into his neck, and it's called a tracheostomy, and that helps with his breathing. Okay? So this is all very normal, and believe it or not, it's very normal for people to be sleepy like this as well. Oh, bless him. He's doing well. He's doing well. We've made lots of progress. Okay? Can you put your tongue out, Rob? You try and put your tongue out?
Yeah,
there you go.
It, come on. I know you're tired, but you'll get better every day now. Do you know what I mean? I do love you so much. I miss you so much. Love me too. I know you always tell me you love me.
Oh.
I was in the situation for the first time the other day where I phoned a family and said, unfortunately, your loved one is going to die. And I thought to myself at the time, what on earth can I do to make this vaguely human? So I spoke to the daughter of this person and I said, I don't know whether this is going to sound like the most barbaric thing ever or whether it's something you would entertain, but we can possibly video call the end of life. And she actually said, oh God, that would be great. At least I would feel like I could be there in some way. So we prepared everything and we made contact via video conferencing, and she saw the face of her parent and she said what she wanted to say, what a fantastic parent they'd been, and all the things she wanted to say to him but wouldn't be in a position to. And when she'd said what she wanted to say, we turned off the various vasopressor agents, etc., and amended the alarm settings so that the buzzers didn't keep going off to interrupt the end-of-life experience. And it was very much like it would have been had she been in the room. And we sat as a group and she watched her dad's face throughout the whole process, and he died with her talking to him. At least that person will now know that her loved one was looked after by people who cared, and she knew our names, and she didn't see our faces, but she saw our eyes and she heard our voices, and she will picture the fact that he was surrounded by people who really did care. It took me about 3 days to get over what I'd seen and what I'd been part of, and it's not a normal thing. One of my colleagues said to me, I know you think this is a really good idea, but what if someone's filming that and puts it all on the news and that's the end of your career? And I said to her, I may be really foolish and you may be completely right, but if I'm going to lose my job over something, I guess this is the thing to lose over. I just have to hope that people are good, and we all come from this trying to do our best, and none of us have answers.
Today's Good Friday. Normally, if it wasn't for the emergency rota, I would have been off with my family. I have a 5-year-old who's at home at the moment.
Well, actually, to be honest, I'm hiding downstairs in the kitchen because she's currently watching Ariel upstairs. So Daddy's looking after her today whilst I'm coming into ITU.
I can't wait for some rain to come because this hay fever is quite horrible when you are working in PPE. It's somewhat unpleasant to feel the dribbling of your nose going in the mask. On the other hand, it's a beautiful morning out there, so if you can do your social distancing walk and exercise, please get out there.
I'm going to sit on my bench and I'm going to sit and get some nice sunshine, because once you get onto the intensive care unit, you have no fresh air, artificial light, lots of noise. So I'm just going to sit here for all. Let me just show you where I'm looking at. You can't see my husband, he's out there mowing the lawn somewhere. And that's the time that I'm going to spend with him when he's finished doing that before I go to work.
Life is strange, and actually the one thing I really notice at the moment every day when I wake up is that I miss my mum and dad. I wish I could see them. They live in Cornwall. I wish I could drive up to their house and wave at them through the window or something, but just makes you realise how lucky you are to have what you have, and it will hopefully all come good in the end.
I'm a little bit tired, but what I have done to combat tiredness is to clear that area of the garden. It's quite therapeutic. If you are a little bit angry about COVID-19, a bit of hard manual labor is definitely calming.
We've spoken to Tesco in Newport, who have kindly donated a load of Easter eggs, which we're going to bring to the intensive care staff. And here they are with Ollie. What have you got there, Ollie?
We've got a load of Easter eggs.
Nice. How many did they donate?
100, wasn't it?
Yeah, amazing. I bet they're melted, though.
Not too bad.
Not too bad.
It's Easter Sunday, and I'm back in the game again. Just getting ready for the 24-hour resident shift on the ICU.
Thanks. I think we are somewhere around week 7, 8, and the peak is expected at week 12. Thank you.
I'm Liz, by the way.
Nice to meet you. I'm Thomas.
Hi.
Currently, we've got 30 patients. That is almost triple our normal capacity. And out of the 30 patients, 26 are COVID positive or suspected.
Now this will be an interesting ward, and I've got a terrible hay fever, and I already feel some water trickling down my nose.
Oh no.
Well, the main ICU, as you know, previously, that's full of 15 patients. The recovery has got about 8 to 10 patients. HDU and PACU have got 8 patients. And I've just admitted one into the CCU, the coronary care unit, which we have taken over as ICU. So we've already expanded a lot.
You all right? Yeah. Okay.
We're now looking to take over, in inverted commas, the day surgery unit as our next expansion area when coronary care is full.
And then we're also looking at taking over the whole of Ward D3 as well. So if we expand fully, the plan is to take over 70 beds, which is a huge increase in our capacity. And that would put our footprint similar to that of some of the biggest intensive care units in the country.
So this used to be a D3 cardiology ward, and now these were bays. These have all had doors put on them, and if we open, these have now been changed into 6-bed pods for us. We've got 1, 2, 3, 4, 5, 6 set up.
We're hoping to have a respiratory weaning facility next to the current high dependency unit, so that we can cohort the people who are further along in their process into that particular clinical area, so they can have lots of input from physio and speech and language, so they can be weaned from a respiratory perspective, but also reablement is a big part of their recovery, because they will become very weak during their prolonged periods of ventilation and the severity of their illness.
It's getting worse and worse, really. I was saying to Chambers that, the numbers don't seem to go down. The patients who come in stay with us for longer, and, we're getting more and more patients.
She's very early. We just have to accept that they will keep doing this for at least another week.
The 30 we got right now, there's a lot of them who are 2 weeks, into their admission right now.
Yeah.
And we've got a first patient still here who is 1 month into his stay.
Wales has the lowest number of intensive care beds in Western Europe, and in Wales, Aneurin Bevan has got the lowest number of critical care beds per head of population. So by definition, we're an area that's got the fewest intensive care beds per head of population in the whole of Western Europe. Cases per 100,000 here are somewhere in the order of 300 per 100,000. You can compare that with the case rate in Italy, which is about 170 per 100,000. So taken as an average, we are disproportionately affected in terms of the UK.
We're getting around anything from about 2 to 5 new level 3 admissions per day. We get more referrals. Some people don't need it. Some people wouldn't benefit from it. So those are just the people who actually come onto the intensive care. But number of cases wise, needless to say, there are far more presenting to the hospital than that.
We're on top of things at the minute. We've got space still. And the one thing I was really frightened about was that we were going to have to move to a sort of pandemic or battlefield triage model, where basically you save the ones that can be saved, and anyone who's desperately ill or who's going to need a huge amount of resources to get better, you basically write them off.
Going into recovery now. See what's going on in here.
Thankfully, we haven't had to apply that model. There's a lot of talk, certainly from the reports coming out of Italy, and that's one of the things we've been bracing ourselves for, is the need to allocate resources based on, all sorts of mad criteria like age, or if you've got two 20-year-olds who both need a ventilator and there's only one ventilator, who do you give it to? Thank God at this stage we've not had to make any decisions like that. So at the minute we are running on our usual triage model, which means that anyone who needs intensive care who we think will benefit from it will get it.
I'm going to go and see him again now and make some decisions.
Currently, and despite that we are in surge capacity, we are still operating on exactly the same clinical decision tool. So we always look at the patients, we always look at their phase of illness, we always look at their comorbidities, and we try to decide whether critical care would be in the best interest.
We have admitted some really quite elderly people to intensive care with coronavirus, but they have been selected because of their rude, robust general health and their absence of other pathologies. It is not about age and years, it's about the underlying physiology and the state of global health.
While we can do many things, actually the whole point of doing them is that you've got someone who can not only survive, but survive to a quality of life that is acceptable to them.
Just got up off my night shift, gonna go for a nice walk now, get a bit of fresh air with my girls.
Just arrived at the school now to come and pick up my daughter. The schools have been fantastic, staying open in the day, but when I'm nights, my mum has them for me. It is a worry. It's a worry when you go to work every time that you're going to come home, give it to your children, pass it on to my mum. When you reflect on the patients that are on our unit, a lot of them are younger than my mum. So it's obviously in the back of my mind every time that I drop them off there and go to work that I'm putting her at risk.
So we've got Leland, ITU.
She's just over here, she's hiding.
We've got Ollie, who's filming, anaesthetic training, me and Kristen, anaesthetic trainee. So we're all part of a team, so we're doing the same shift patterns. We are 4 till 1 today.
Coming
little bit earlier as I need to be fit mask tested because we've run out of the old masks, so need to be tested on the new ones just to make sure that they fit. But we have to be grateful that we've got these because obviously they're keeping us safe.
So we're just having a bit of a lunch break. Done some procedures this morning, so I ended up wearing like 3 layers of kit, which is pretty warm, but we've had a good morning actually.
I've been on the HDU mask. They are mostly ventilated. One of them's been extubated and is doing very well, sat out in a chair, which is huge.
Lunch, someone's very kindly supplied. It's Dr. Demont. Dr. Demont used to do ITU how many years ago?
8.
And is really embracing coming back.
Loving it. Living the dream.
Living the dream.
Or nightmare.
Doctors are an issue, undoubtedly an issue, but it's less of an issue because we have been able to borrow junior doctors from other areas and divvy out some of the tasks that we would have been doing previously to other teams.
Very first setting them up how you do the calibration for the oxygen and the CO2, and other than that, it's not too bad.
Within the last few days, we've started to have teams in from dermatology, surgery, maxillofacial, ENT. They've divided into teams and they've put more senior junior doctors, so those nearing the end of their training and nearing consultancy, to be sort of a team leader.
How was the night shift, guys?
Busy.
Yeah.
Quite entertaining at times.
No dramas?
Several minor dramas.
Look at the patient list, which is normally very small. You can see a lot of patients. Is that one department?
That's one pod.
ITU. That's one pod of 4.
Yep.
We've got juniors from other specialties who have done no ITU. They are all of a sudden finding themselves in the nightmare that is in a pandemic, in a makeshift ITU, and treatment concepts and procedures that they have absolutely no knowledge of. And what that must be like, I can't imagine.
Are you happy to do that, Leon, or do you want...
Yeah, no, that's fine.
Yeah, sure. Yeah.
We just support each other and accept that it's not ideal, but we're grateful for what everybody does, and we hope that we're all learning together.
Mummy's home today, isn't she?
Yeah.
And so we're going to go on a bug hunt.
Yeah.
And do a little exercise, some fresh air whilst we're at it, yeah?
Yeah.
We know the reasons of lockdown and we know how important it is. But trying to impose it onto a 5-year-old, let alone her not seeing any of her friends, not having any play dates, any sleepovers.
What are we making today?
Cheesecakes.
Yeah, and who's it going to be for?
The doctors and
Nurses.
We can't bake like we used to, so basically it's what I can get from the supermarket. I'll rummage through the cupboard to see what there's left.
We all feel like a team, but we all feel like we've come out into war at the moment. It really does feel like that.
Sometimes the best that we can offer patients when we've exhausted all other options is that they have a good death. My own daughter died on an intensive care unit as a neonate, and we were there with her. And as much as that was a really hard, one of the hardest things that anyone could even imagine going through, I would 1,000 times choose to be there. And for those families not to be able to be with their loved ones as they pass away is just horrific, to be honest.
The hospital at the moment feels like two complete opposites. The life has been dragged out of the corridors and pulled into the wards, and behind closed doors, it is controlled chaos.
Nothing prepares you to see what you're seeing in the unit at the moment. The hard thing is, you know, trying to keep the patients going and trying to keep them as well as we can. It's hard because we're limited with equipment, we're limited by space.
We have had to use drugs that we don't normally use, which do the same job, but it's kind of unfamiliar territory. and makes the nurses' jobs harder because they're switching between different medications. As we run out of one and go on to another, lot of supply.
Running out of standard drugs, running out of kidney machines. These are issues that prior to COVID never really anticipated. There's just so many layers to this problem at the moment. And once you feel like something's resolved or you're getting on top of it, there's another layer, another problem that becomes identified.
Have you got any in there?
No, I've got one.
What size?
Well, give me any size which is 8 or 9. Okay, I don't mind. I need 2 more. 2 more and 3 of the cut down sets. Yep.
Our big problem today is we're running out of stock for our kidney machines. And if we run out of the fluid for the kidney machines, then we can't give people dialysis, and there are, a large number of patients who need dialysis. At the minute, we've got 5 days supply. And if we run out in 5 days' time, then at least 12 patients on the intensive care unit will die as a result of it.
I want the catheter mount for the bronchoscope.
Hang on then. Catheter mount. I'll write it down
Yes.
for the bronchoscope.
We still have to face a shortage of staff.
That's fine. I can make it up.
Okay, yeah.
We still have to face a shortage of different equipment.
You know that stuff that Swansea was meant to give us?
Yeah. Not coming.
Not coming. They miscounted. They thought they had twice what they had. So we're officially seriously in trouble now.
Drugs and consumables are global shortage because there are a lot more patients on critical care everywhere in the world, and everybody in the world is using the same drugs. And the lockdown from the different countries and the lockdown of the borders is not helping.
We would need to get somebody from Welsh government to contact the regional medical director at the Southwest so they can enact mutual aid across the border.
This is where Welsh Government and the Critical Care Network became really important to coordinate and actually find out who had what kit, who was needing it most, and then actually centralising supplies and moving it around. But that was a huge organisational effort to overcome that. So you reckon they got stock in the Southwest?
Yeah.
Okay, cool. Okay. Well, I'll go and try and see if we can't sort that out now then. I'm hoping that we will get a delivery in the next couple of days, which would make a huge difference. And we've been very lucky that we've been lent machines and fluid from other health boards, which has really saved us.
There are a couple I think we need to have step back and think, where are we going? Where are we going?
Yeah.
I've just opened an email from one of our respiratory colleagues, and she's just emailed me to say that one of the early patients we took in just over 2.5 weeks ago went home yesterday. So that is fantastic news, and that has definitely put a smile on my face.
Cautiously, I would say that we are almost there. Whatever they have done overnight, it worked. Yeah.
How is it working over here, Joe?
I've got 2 patients today with the help of lovely Judy. So, yeah.
Well, you've got a good bunch then.
We're managing okay, yes.
I think you are definitely well enough that we can get you back to the respiratory ward, and hopefully a couple of more days in the hospital, and then you can go home.
How you doing, Meg?
Hi, I'm fine, thank you. Just drawing up some more drugs.
So it's 3 o'clock in the morning. I'm just walking up a very deserted hospital corridor. I'm going to go and have a sit down and try and have a rest. There is warning of one person out there on the wards who's doing okay but might come our way, so we'll see how that goes later in the line.
So just home, looking forward to some food and seeing the kids. Yeah, good day. It's been an amazingly quiet drive home, as everything is these days, because there's no one around, which is fantastic, and people are doing exactly what we need them to do. And that will make this hopefully manageable for us. And I was thinking about that on the way home, actually, that I feel that if people do stay home and they pace ourselves, then we can make this work, and we can make this achievable, and we can manage the numbers coming through. We've static now for 3 or 4 days with numbers of about 33, so that's really good, because that shows that we're not getting that massive increase in numbers that was feared.
In the last 9 days, when I look at the Orwell's figures, it has been almost to the number exactly the same. So it does look like that the whole social distancing is working. I think we are at the plateau phase.
Thank you, girls.
At this moment, we are relatively confident that this wave we will be able to cope.
We're getting people in a kind of slow dribble, but certainly not the numbers we were experiencing 2 or 3 weeks ago. And I believe firmly that we are at the end of the first peak. And when social distancing and lockdown is revoked, we will get another peak. And it will be a replay of what we had a month ago.
I think the problem at the minute, there is no end in sight to this. You know, the public health projections are that there's going to be a peak in July, where they reckon there might be up to 180 needing ventilating, which again puts us back in the same position again. And then there'll be another one in October, where the projections suggest there might be up to 800 people needing ventilating. So if we get to that stage, and things aren't mitigated, and flattening the curve and all this sort of stuff doesn't work, or people just get bored of isolating and go out and start milling around, then we are fucked.
I don't believe we will see the end of the coronavirus for a long time. It's like we've had our first sitting, our first course. When we talk about what we've been through, we will talk about it as in, do you remember what happened in the first wave? And the second wave was a bit different because of such and such. And we will remember it as waves.
It has been a massive period of anxiety for a lot of people. There are a huge amount of stresses with it, but actually there's an amazing amount of positives. You know, I look at the overwhelming generosity every time I go into work. Someone's provided some new headbands. Someone's been reformatting phones that people have donated. Food that has been donated and continues to be donated. Myself, I managed to get myself to the front of the queue in the shop the other day and had forgotten all financial help. So looked really foolish. And the lady behind me paid for my shopping.
From a personal perspective, as much as the lockdown has been difficult, it has also been it's a period of personal reflection.
This is homeschooling.
Woo! Talking to my kids the other day and saying, what have you noticed most about lockdown? And even though I'm in work far more, what they've taken from this is that mum and dad are at home a lot more.
Oh. Good girl.
I believe that the inclination of mankind to recognise the value of the family and the community and time spent just being and valuing their health and valuing the health service is something which we will be able to bring forward into the future.
The one thing that's really struck me is the ingenuity and the resourcefulness, the camaraderie and the can-do attitude, people looking out for each other, people looking after each other, and actually the fact that we've been able to cope and we haven't been washed away by this pandemic is testament really to the staff, the whole organisation, but also to people at home. We will all come out of this changed. I don't know how yet, hopefully for the better.